Hello again. Today is the 23rd of March 2020. I want to discuss about the importance of sharing information. Sharing information, don't share a virus. Okay? So that's the important thing. Okay, so my point is to tell everybody to share my videos. You can subscribe and click the bell, do the normal stuff, and also very importantly, share my videos. It is great that you guys are watching it and getting this information, but you gotta pass it on because it's for everybody to arm themselves with good knowledge. Okay? And I have good, certain, and complete information about this subject. Okay? I give sound advices. I have easy to understand messages, and I like to think that I'm entertaining as well along the way. Well, I try to be a little bit from time to time. So much for advertising. I mean, there's a lot of information out there on YouTube. There's a lot of information on the media, but I want to compare myself to the doctors and scientists. Well, mainly point out what they're not doing, okay, or what they're doing wrong. Not wrong, but what's not enough about the stuff they put out. So I watch Dr. John Campbell almost daily. I've watched Stanford Medicine. This is like a forum that they have different people, the medical staff exchanging their stuff. These are all really good videos. They give you good information, especially Dr. Campbell. However, there's crucial problems. Okay, they don't have conclusions because scientists, they tend to use this as an experiment. We are in a great experiment. Okay, we are in this time of turmoil, and we haven't gone through this, so we can only draw on past experiences, the doctors. But this thing is new. It's a novel coronavirus. They don't have all the data they want, so they are reluctant to come to conclusions, and they don't offer predictions. Well, they do. They have mathematical models, but I'm going to get to that. It's hard to sort out their messages. It's hard to understand because they have their jargons and their figures. And if you're really technically savvy, and if you understand data, and if you understand the healthcare science, by all means, that's good. You can go break it down, and you'll probably arrive at some good information. But again, they're not speaking to the public. Well, he is, but these guys are not. They're talking about themselves. And Dr. Fauci is, and there are plenty of people are. But the crucial and sort of fatal mistake is that they are depending on data from China. They're still using it, and they don't have good data. It's just like fake data. It's fake news. So it puts them into a really bad place, and they don't know how to deal with it. They are so serious, and they're so truthful to their letters, to their numbers. So they don't know how to deal with fake numbers, and what to be taken in and what not to be taken into account. That's where I come in, so to speak. I come in here. I give you simple results, like simple things, instructions, more than what they just advise you to wash your hands. I tell you masks work. Okay, I tell you to stay out of anything, to have the school shut down, and to not go to supermarkets or not go to church, things like that. And my messages are simple. They're just normal language. I don't use jargons. As a matter of fact, I break it down. They use some jargons. They talk about death rate. It's percent of cases. You're gonna get that. You're gonna understand what that means. You think that only 1.2% dies, or something like that. That's not how it is. Okay, again, I want to look at Koreans. They're doing really well. They recovered a lot of people lately, just past couple of days. Went from 1,500 to, pretty much doubled, and then some, in just past 2 days of their recovery number. So I think it's after 27th day, is that a couple of, the initial diagnosed people are getting, starting to recover around this time. So they're seeing their recovery rate number rising a lot, and then that actually brings down the countable death rate that I have. So it's down to 3.39%. It's a good sign. Just a couple of days ago, it was 6.21. So that means they have about 56 100 people still battling this disease, and some more people are going to get it, as you see that they still have an increase of the total case, but their recovery rate is higher. So if you look at this blue line represents their total number. The red line represents how many people are still sick. Okay, I did a plot. I missed some data in here. It doesn't matter. So this is the trajectory. As you can see, that the number of people that are still sick is going down dramatically in the past 2 days. Okay, and their calculatable, countable death rate is approaching a realistic number. So we look at this 40 something, 25 something, 6, and then 3. We can project that it's going to come down to maybe 2 to 3%. It is not 1% that people have been talking about. Okay, so that's because Korea is doing everything right, and then they're bending the curve down before it gets really out of hand. And that's not happening elsewhere in the world except for East Asia. Okay. Yeah, that's the case fatality rate, and then as a really good scenario, we're looking at that, maybe slightly lower than that, so 2%. That's my initial assessment as well. Okay, it's not 1%, it's not 0.7 or 8% like President Trump is telling you. That brings me to the next point. If you're looking at the media, if you look at government, there's so many mixed messages, right? Dr. Fauci is saying one thing, President Trump is saying one thing, Mike Pence is saying something, and then the Surgeon General is saying something, and then different governors are saying different things, and oh my goodness. And the journalists, they're questioning this, questioning that. They're doing this sensationalism for their reporting. That's how they used to conduct their business. That's how they make their money. That's how they're getting their viewership. But that creates this huge cloud of misinformation. So you have to sort that out, and really hard to sort it out. I mean, we wouldn't be wrong to follow Dr. Fauci and professionals on their opinions, but there's just so many other things going on, and it gets confusing. Okay, so again, if you watch me, you get sound advice, easy to understand, and make it simple. So you got to share that. Okay. So, in conclusion, you're getting inconsistent and confusing messages everywhere, as where my messages are really consistent. If you go from the beginning of time, you have to take time into consideration, right? I tell you about a bunch of stuff, and then things are really happening according to what I told you. And then now we're taking some measures, and then now things are probably should be better. But now we lose data for America. We don't have a way to count everything. Let's look. Okay, this case number, total confirmed, is different from this case number. The death rate is death toll is 500 something. Recovery is 0. There used to be some recovery before, so now it's like just chaotic. They have these daily increased data and all that. They're trying to do something. See, this is what the scientists are doing. They're trying to find out what's going on, but they don't have good data because we don't have testing abilities. All right, so the only good data so far is from Korea, because they're testing. China is doing the same thing, testing, but they're doing some other practices, politically altered numbers and all that. So the only sound data is right here, but they're doing the right things. If we don't do the right things, we're not going to follow their curve. Okay, if you see their curve, it's the same thing I started right here, right? February something. See, it's the same curve right here. All right. Okay, so. Again, if I want to put things in perspective, what can we do to battle this? Half of the battle is knowing what you're dealing with. Okay, half of the battle in everything is knowing what you're dealing with. So information is half of the battle. Okay, and information can travel fast. Again, go back to my original message for this video. You gotta share this information. You don't just watch it. Okay, half of the battle is knowing what's going on. Okay, the other half is actually doing things. Isolation, quarantine. Okay. That's 20% of the whole thing, but 40% of the rest. And then testing of who has it. That's another 20%, because without testing, we don't know who to quarantine, who to isolate. All we can do is stay at home. Everybody's staying at home, and nobody does anything, right? So nobody does nothing, or something like that. But that's we're not talking about social distancing. Distancing is when you actually have to go into public. This is more important. People, don't go out. Stay home. Stay away. And there are measures you got to take, to enforce like a sort of a physical barrier for the virus to step into your home, right? Don't allow that chance. Okay, testing is crucially important, just as important as quarantine. Okay, but right now, unfortunately, Korea has testing. We don't. The U.S., Europe, we don't. Asia is doing well, very well with testing, and we are not. We're just falling behind. Why? I don't know, political or something, but that's the situation we have. So, we can't rely on that. Until the government, puts their act together, there's nothing individuals can do, right? Now, the other 10%, the rest of the 10% is social distancing, where everybody puts all their emphasis on. Everything is about social distancing. No, it's not. Social distancing is the last resort. It's when you go into public, when you have to meet with somebody. Then the last resort is, okay, stay your distance. Don't touch them. Elbow bump. Don't even do elbow bump. Don't even kick each other's shoes. Okay? Just stay your distance. Nobody's gonna blame you for not hugging them. Okay? In this time, hand washing, mask wearing, very important. This is all part of social distancing. Also, clean up your stuff. Clean up when you go to public. When you come back, clean it all up. Clean it all up. Use a UV lamp. Use something. Bring a physical barrier between your home and the outside world, between your car and the outside environment. Okay? Carry your stuff into your car. Carry those wipes, carry those sprays into your car. And then, just constantly cleaning yourself up. Okay, I'm going to do another video about this. But share this video. Share every video. Share it with your friends. Share it with your family. Everybody needs to know these things. And I put it down as simple as you can get. If you're really technically savvy, you have the time, you can, yes, go ahead and watch these guys. And there's more information on it. There's like a gazillion video on YouTube. Go watch them. But if you don't have time, or you don't have the the know-how to deal with those information, just come watch all my videos, and you're going to get the same information, possibly better, because I know what's going on in China. I know what's going on in China. Much better than the scientists. They're deceived. That's why we have such a horrendous problem in Spain and Italy. Okay? Horrendous. Look at the death toll. Oh, Spain, just Iran. Sorry, Italy is way up here. 6,000 people died. Spain, 2,000. Germany, okay. 4 digits in the thousands. And it's not, we're not slowing this down. People are just realizing. I saw a video of an Italian mayor just ranting angrily at his people because they wouldn't stay home. I guess they are staying home now. Look at this curve. But who knows? Too many people have died already. Way too many. Unnecessary. And we don't want it happening here. We're still in 3 digits. We want to keep it down. Alright? So, most important thing, knowing what's going on is half the battle. Share this video. Share this channel. Okay? I'm doing self-promotion because I need you guys. I want to stay alive. I need you guys. Everybody needs to stay alive. The more people get it, the less chance we have. Every one of us.